For those of you who are just hopping on, I've already started the recording, so yes, it will be recorded. Are you all on mute and your cameras are off? Is it not allowing you to mute yourself? Sometimes with large webinars, it may not allow you to mute yourself, Talisha, unmute yourself. But if you want to speak, then there's like a raise hand and then I can unmute you. And let me see if I am unable to. Yeah, I can't see you guys on video, but I can definitely unmute you. Alrighty, so we'll go ahead and get started. I told you guys it'll be an hour and a half, so I'll try to stick to that promise. But welcome to our NCLEX pharmacology review. Okay, she said she wants to be muted. Okay, all right, so I'll try not to call on you, Talisha. But welcome to our NCLEX pharmacology review. If you guys want to take a brief moment to put in the chat box what school you attend, what college of nursing you're attending, or if you are preparing for the NCLEX, that would be great. All right, so we got Herzing. Am I pronouncing that right? Herzing. All right. What other schools do we have? Nursing schools. All right, Kaden. Your hand. You see. All right. Kaden, did I pronounce it right? I muted you.
My chat's been disabled. I'm not able to write in it.
Not letting you. I am not sure why. It should allow you. Should allow you guys to use the chat box. Okay. Should let you guys use the chat box now. All right. Is it Chakisha?
Yes, my chat box is disabled as well.
Still disabled. Okay. Guys, give me just a second. I am going to, I think this is what's happening. Give me just a second. Maybe the QA. You should be able to. Okay, well, we'll try that. It's a little different when it's a big webinar. Okay. I am. It should allow y'all to use the chat box. What's the panel? Okay. How about now?
It
Yes,
works.
it's fixed. Thank you.
Okay, great. I was like, I've never had this happen. Okay. Thank you guys for your patience. From Arizona. Awesome. Awesome. Okay. Now I'm seeing the people. Okay, great. Great. SoCal. Yes. Oregon. Amazing. New York. Awesome. Awesome. Well, thank you guys for your patience, one. And then thank you for joining us. It's Friday night. You could be doing so much more, but you're here to study pharmacology. So that speaks volumes. Texas. Yes, St. Paul. Yes, yes. UT. Okay. Union. Chamberlain University, Georgia. Yes, yes. Awesome. You guys are awesome. Just from everywhere I see. We're all over the place. Yes. Great. All right, guys. Well, keep them coming in the chat box. My name is Jehr. You're probably like, well, enough about us. What about you? I am Jehr. I am a speaker, a nurse leader in the state of Tennessee. Some of you guys may know me. I've probably taught some of you, or I've probably done some webinars in the past for you guys. But if you don't, I'm a nurse leader as well, an educator. I was a nursing student just like you, preparing for my NCLEX in 2021, so not too far off. And then I graduated with my master's degree in nursing education 2023. So that was a really tight space, but I love nursing education. I knew that I wanted to be a nurse educator when I was a nursing student my first semester. So I would actually study my instructors and see how they taught. And when I got out of their classes, they would actually show me how to develop PowerPoints and just different things like that. So I kind of been in the game, but not really in the game for a good minute. And then after graduating, now I teach clinical at University of Tennessee, and I'm a state leader for our association. NCLEX coach, so I coach from home. And then I'm also an institutional consultant. So I go in and speak to different deans and directors. If the schools are struggling with their NCLEX pass rates, then that's where I come in at. So a little all over the place. But I am here tonight to help you guys master pharmacology, okay? All right, so these are some of our learning outcomes. I will let you guys read them. And then you'll notice at the bottom, it's not really a learning outcome, but it is an outcome. So we do have one lucky attendee that will win a 6-month Picmonic and True Learn subscription. And then one winner will get some Picmonic swag. And I love Picmonic swag. It's super nice and super cool. And then sometimes you may have some people that may ask where you get it from, and it's written on the shirt. So we'll see that later, and somebody will win that. All righty. So again, we'll jump right into it. So why pharmacology breaks students and how to beat it. So for those of you who are preparing for your NCLEX, pharmacology is one of the top 3 reasons students fail the NCLEX. Pharmacology. And some of you are probably like, I'm not surprised. That's why I'm here. But don't let this scare you. It's just to make you aware. Most students try to memorize a lot of medications instead of learning how to think through them. So remember, there's a plethora of medications. Even what you're learning in nursing school, there's not enough time to even cover every single medication. So imagine trying to do that once you graduate or for an exam and you're getting into overload, and guess what you remember? Nothing, right? Because we're trying to remember hundreds of medications. And then we start to overwhelm ourselves. We get super anxious, feeling like we have to know everything. And then we get burned out and discouraged because we hate pharmacology, but we have to know it, right? But the real issue I've learned over the years is that it's not due to intelligence. Rarely is it that students just don't know the content. Very rarely, right? It's because they don't have a good strategy or a good toolbox on how to approach pharmacology, right? Because there's many different ways to do it. And you may have to pull different techniques out of your toolbox. And now you guys are like, okay, where's this invisible toolbox, Jay? You're talking about a toolbox. We don't have one. Well, that's why we're here, okay? All right. So I'm very goofy, if you guys haven't noticed already, but this is what happened in my first semester of nursing school. I had a friend and I who didn't do too well on our pharmacology exam. I had high spirits because I'm like, okay, well, it's just the first. And I love a good challenge. And I got a 76 and she got a 74. So that was a pass and fail, just 2 points away. Right. And so I supported her. We went to our instructor, and I should have been right with her. We'll talk about some of those techniques a little bit later. But I was there for moral support. And the instructor said something I'll never forget. Now, this is my very first semester of nursing school. He said, it's not that you don't study, it's that you don't know how to study. And it was true. It was so true, but it did not, I don't know why I didn't laugh at her. I was laughing at the fact that he was just, we were looking for just so much. We thought he was going to give us a book and we thought he was going to give us just a bunch of resources. And it wasn't that. It's just not that you don't study. You spend hours of studying for pharmacology. Sometimes it's not that we don't know how to study, is that we don't know how to study. You're like, okay, well, Jay, I made an A in this course and I did this and that. And so that's not always true. But we do know for every subject in nursing school, we may have to approach it a little differently. All right. So that's what I found to be true for NCLEX and just different things is that most of my clients do study. They just don't have the right tools. Right. Someone said, I don't know how. We'll learn. We will learn. It's okay. We're in this together. All right, so here's strategy one, which is one of my favorite ones, and it works for pharmacology, and it's active recall. Okay, active recall improves long-term retention of medications more than rereading, right? So some things we can get in our textbook and we can just read over. Medications is probably not the best thing to try to study by rereading and rereading and rereading. It's very hard to understand any type of medications, talking about pharmacology, by just simply reading, right? That doesn't really help with retention. All right, so we're going to take this medication, for example, betamethasone. What type of medication is this? Steroid. Okay, right. So when we're using active recall, instead of saying, reading that betamethasone is a steroid, you can rewrite it, you can create it into a question and say, what type of medication is betamethasone? On the back of your card, put steroid. Okay. This type of strategy does not work for a lot of nursing courses because memorization is out of the window for most courses except for pharmacology. Okay, stick with me. Not everything, but a lot of things you can retain in pharmacology using active recall. And that's one way I studied. I actually used mnemonic when I was a nursing student, and active recall was an approach that really helped me. All right. So you see how I have the questions here. What class of drug is betamethasone? What is it? What is the purpose of it? Okay. Because we know that that medication is given usually to what type of client? Mm-hmm. Yep. Yes, 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 yes. Right? So instead of just reading this, now we have a set of questions that will help us retain the information. Okay? So, what patient population should be closely monitored? We may read it as the pregnant woman who needs it for the baby's lung to mature, right? We may see it written as that, but how can we take this and formulate a question? And you can do this on your own. You can create your own questions and create flashcards. So I would take these questions, Picmonic did it for me, but then I would also create my own sometimes. And I use what is called the check in, check out method. And every night I would set a deck of cards because you have a lot of medications to learn in pharmacology, especially those of you who are getting ready to take pharmacology, or you've already taken or you're in pharmacology now. You have quite a few medications to learn before your exam. So what I would do is take about 15 cards at a time, no more than 15, sometimes 10, and I would go ahead and write that down. Go ahead and write them down on flashcards, however you want to do it. You can create different questions. Sometimes you can just put 3 questions on each flashcard. But you want to go ahead and create a set of questions and then put the answers on the back. And then every night before you go to bed, go ahead and check out. When you wake up in the morning, check in. So even if you're studying for another exam and you're like, oh my gosh, I don't have time to study for pharmacology, guess what? You have 15 drugs that you've already mastered in just maybe 2 days, right? Active recall. It works. All right. All right. Strategy 2. We are going to learn our medications by class. So this is our first giveaway. And the person that will win the first giveaway will learn the medication, will name the class, okay? So you will have to name the class of every medication listed here. And you only get one chance, and then the next person will have to go, okay? So do we have any volunteers? All right, I saw Talisha's hand go up first, so we'll go with Talisha first. All right, Talisha, I unmuted you.
Okay.
All right, and then we can go like down the line, amlodipine, metformin, just
Oh my
like
gosh. Okay, the peen is a calcium channel blocker. Metformin. Oh my God. Why did I do this?
you got it.
That's metformin. Metformin is used to treat but the class though. Metformin is used to treat for diabetes,
Yeah,
glucose,
it is. But what type of medication is it? What type of classes? We're naming that
the
class.
class. Oh my God. Um, insulin. It's not insulin. It ends in, I don't know the class for metformin. Ooh. Okay, I need to call in a lifeline here.
Oh, I love that. I love it. Okay, okay. All right, who's gonna be the life? It looks like Patricia is your lifeline.
Well, come on, Patricia.
You said call on Patricia. Patricia is gonna take the win then.
That's fine.
That's
I'm,
all.
that's
All right, Patricia, do you want to go or Eve? Eve, I think you were next. Okay, so we'll let Eve go next. We'll play it fair. We'll be fair. All right. And then what we'll do is, yeah, okay. I think I unmuted. I muted you,
Okay.
Eve.
Hi, everybody. Do I go down the list just like the last person was?
Yep, yep.
Okay. Okay, so thank you for helping me, the last person. But I mean, okay, amlodipine is a calcium channel blocker.
Mhm.
Metformin is an anti-diabetic. Phenytoin is a like a anti-seizure medicine. Lorazepam is a benzodiazepine,
Mhm.
and clopidogrel, I don't know what that is. Ondansetron is a that's Zofran, or it's a anti-nausea or anti-emetic or something. Levothyroxine is
Yeah.
well, it's a hormone. It's a how would you say it was a thyroxine agonist or something like that? Maybe that's how you say it. Pantoprazole. What is
It's
it?
awful.
I
Pantoprazole.
I forget what pantoprazole.
Oh, come on, somebody help her. She's close.
Okay, a protein, I mean a proton pump inhibitor.
There we go. There we go. There we
And
go.
and someone put it in the chat, and that's how I know. So I cheated. And prednisone is a corticosteroid.
Awesome, awesome, awesome. Wonderful job. To the both of you who participated, wonderful job. And I will give you both my email, and then we can move forward from there. But great job. Did anybody have any questions about any of these medications in the classes that were named? I feel like they did great. They did really good. I don't know if I'll be able to, if I were a student, I wouldn't be able to do that right away. But wonderful job. All right, guys. I don't know why it keeps wanting to go back. All right, so let's get into strategy 3. And this is my favorite one, leveraging visual mnemonics. Pharmacology, I don't know about y'all, but it can get a little boring to me. Seeing those PowerPoints in class, you have 100 slides, then you have to go home and study it. Then you got to create flashcards or you got to do something to retain it. For me, my something was drawing. I love to draw in nursing school. So, um, let's go back. Okay, yeah, I love to draw in nursing school. So this is actually a medication that I remembered since my first semester of nursing school. And this is how I remembered it. So dantrolene, it is a muscle skeletal relaxant, skeletal muscle relaxant. And how I remembered it is by Dan the Skeleton. Now, warning, try not to give them names when you're in a professional setting, right? So don't call dantrolene Dan the Skeleton, or the patients are going to look at you like you're crazy. But so this is what I drew in nursing school over here. Don't pay attention to this over here, but this is what I drew in nursing school. And I drew a skeleton to remember that it was a skeletal muscle relaxant, and his name was Dan the Skeleton. And that's how I retained it. Okay, so usually if they're going to ask you about a skeletal muscle relaxant, especially for the NCLEX, it's going to be dantrolene. That is a high yield one. Okay, and the only thing that you have to know for dantrolene is that it's a medication called dantrolene and what it is, a skeletal muscle relaxant. Okay, so when you're studying and you find yourself just like, I don't know how, try different ways of doing it. And for me, I love to draw. Well, this was probably my drawing in nursing school, but I'm going to tell you guys that I drew like this in nursing school. Okay. Same thing for this one. Theophylline. It's a bronchodilator, right? So, what are we expecting from this medication? Anybody? Talisha said to breathe. Right, right. We'll make it as simple as possible to dilate the bronchioles. Absolutely. And that is going to help improve our work of breathing. Awesome. Great job. Someone said, can I mute them again? Yes, I can. Eve. Or I can try. Hold on. Okay. Alrighty. So, yes, it's a bronchodilator. It should relax the bronchial smooth muscles. And this is how I remembered it. This is exactly how my picture looked in nursing school when I drew it on my NCLEX card. Okay. And how I remembered it is I thought of Theo the hippo. Okay. So, Theo the hippo, think about hippos when you see them at a zoo. How do they look? How do they usually present themselves? They don't move around much. Yeah, they're very relaxed. I like to call them lazy sometimes, but we'll use relaxed for the sake, oh my gosh, for the sake of this webinar. They are super relaxed. And what happens with the bronchodilators? They relax the bronchial smooth muscles, right? So think of Theo the hippo with that one. Could the zookeeper take their eyes off of them? No. Think about that when we think about the therapeutic range that theophylline has. It's a very narrow therapeutic range, which means that they are at high risk of what?
Yeah, bronchospasm.
Yes, toxicity, overdosing. Yes, so we want to make sure, because we know that they are at high risk for overdosing or toxicity, then what are we going to avoid?
Overdosing.
Giving them too much of a medication, right? So how do we know if we're giving them too much? How will we monitor that? Labs. Yep. So they'll have specific labs, right? But for the sake of knowing this medication, it's most important to know what it is. Yes, they will show signs. Yep. And what kind of signs could you guess that they may experience? Mm-hmm. Stacy said increased heart rate, labored breathing. Mm-hmm. So we just went from relaxed to increased heart rate and labor breathing. That is 0 to 100 real quick. Narrow therapeutic range, okay? Very narrow. Tremors, seizures, arrhythmias. What will kill your patient? Toxicity. Theo the hippo. All right. Okay. All right. So we're going to go into strategy 4, suffixes. All right. Heard someone earlier, they use a suffix to remember one of the classifications. And that helps sometimes. It really does. But master your drug suffixes, especially my friends that are getting ready to take the NCLEX, or you're taking pharmacology right now. That is going to be your best bet. Also, not only do I teach you guys how to study for your exams, I'm also going to give you a clinical tip too, right? Sometimes you may not know every medication, but you better know those suffixes, because you will have your 98-year-old patient who's been taking the same medication for 30 years wait until she's in front of her entire family to ask you, well, what is this medication? And you're like, oh crap, I remember metoprolol, I remember atenolol, but I don't remember Sodalol. But Sodalol is what as well, by looking at the suffix. Beta blocker. All right. So master your beta blockers. I mean, master your suffixes, master beta blockers too, but master your drug suffixes, guys. Most of the time, the medications will have similar effects, okay? So if you can master one, you can master the other. This will be so important, especially when you are taking the NCLEX, because you cannot master every drug. Okay? You can't even master every piece of content, let alone pharmacology alone. So to save you time, if you can't master anything, master your suffixes, okay? Look at our sartan, our prils, statin, okay? We know that that is given for what? Any statin. Doesn't matter what it is, even if you don't see it on the chart. It's given for cholesterol, okay? It's the same thing. So master your suffixes. It's not only going to help you for your exams, but it's going to help you in the clinical setting as well, okay? So make sure you master those. And I'll send you guys a chart at the end of the webinar. All right, so strategy 5, you want to anchor to high yield medications. Some of you are getting ready for your NCLEX and you may have just a couple weeks to study. And you're like, oh my gosh, I studied everything except for pharmacology. What do I do now? Just master high yield medications. Well, Jay, I don't know what a high yield medication is. What is that? How do I know that it's high yield? High yield medications are typically medications that you cannot get away from. You ever see medications mentioned in your first semester and then your second and then your third, and it's almost like it's chasing you all the way to your last semester, and then it's popping up on NCLEX questions? Those are high yield medications, and it's because there's no escape. The NCLEX wants to know that you know these type of medications. And these high yield medications, I will also say that for the most, except when we start to get into OB, you can see them in just about every setting, right? So I tell my clients all the time, the NCLEX is not testing to see if you can be an OB nurse. They don't care. They're happy that you got the job, but they want to know if you can be a safe nurse, right? So they're going to have like universal medications that they really want you to know. All right, so let's look at some of those. Lisinopril. We know that the greatest risk for lisinopril is typically angioedema. You know, sometimes when you call out a medication, for instance, digoxin, what's the first thing you guys think of? As soon as an instructor says digoxin, what are you throwing out? I know some people say halo vision. What else? What are we automatically thinking of? Dig toxicity. Yep. Monitoring our heart rate. Apical pulse. Yep. So that's high yield, right? That's some stuff that they expect every student nurse to know. Guess what? Your nursing instructor is looking at the same thing. They're looking at the same thing. Okay. What about metoprolol? We're looking at the heart rate, right? So the patient has a heart rate of 50, we're not going to give them that. Okay. Same thing with any beta blocker. Even if we've never studied this beta blocker, it's the same thing. Okay. What about our furosemide? What are we thinking of? We know the potassium because I have it there, but what else are we thinking of with our furosemide? Can cause dehydration. What do we want to monitor with furosemide? Someone said blood pressure. What do we want to monitor? Potassium. Yep. So electrolytes, fluids, electrolytes. Yep. Absolutely. Absolutely. And then also with furosemide, what type of diuretic is this? Loop diuretic, right? So when you're studying your medications, especially for those of you who are taking pharmacology now, you're going to have a lot of medications in one group, right? So when you're studying that and you're like, okay, they're all diuretics, now you want to see what separates this medication from that one. With our TB drugs, there's 4 that we give, but what separates this one from this one and this one from that one? Because that's what your instructors are looking for. That's what the NCLEX is looking for. Okay. All right. Yes. In just a minute, Naya. Yep, I will. What about our lithium? Who are we giving lithium to? Mhm. Yep. Yep. Awesome. Our bipolar patients. Yep. And make sure you guys, when you say psych, make sure you're being very specific, okay? Because when you take your NCLEX and you see your questions, you're not going to see psych. There can be different types of psychiatric diseases, that you can give different medications for. So you want to make sure you're not giving the wrong medication just because they're psych patients, okay? So it's specifically we're usually giving the lithium for bipolar patients, okay? All right. All right. And then someone asked about lisinopril. So lisinopril is used for blood pressure. Okay. What else can we tell about lisinopril? What type of medication is it? Mm-hmm. ACE inhibitor. Mm-hmm. Okay. Which patients are likely taking lisinopril? Someone said cough. Yep. So that's a side effect, right? Mm-hmm. Hypertension. So I play patients with high blood pressure. Who else? Who else is likely taking lisinopril? Heart failure. Yep, that's what I was looking for. Mm-hmm. Diabetes. Yep. For what? Why are we really taking lisinopril for our patient with diabetes? It's going to protect their what? It's going to protect their kidneys. Absolutely. And then someone mentioned the cough. That is a high yield side effect. Okay. It's a high yield side effect. Sorry, I'm trying to look at you guys' comments. It's a high yield side effect. So, what happens when the patient has the cough and they're just, I guess, really annoyed with it? What do you say as a nurse? Just deal with it. They're having this persistent cough. Yes. So switch them to a different medication, but what medication will we switch them to? Mm-hmm. Yep. Yep. Absolutely. Your sartans. Yep. And that is a high yield question for those of you who are in pharmacology or you're getting ready for your NCLEX. That is a high yield question. They usually want to know that you can um, give a patient an ARB if they can't tolerate the ACE inhibitor, the pril. Often found that give all side effects, but I haven't had any instructor give a condensed list of the most important. Yeah. No, and we'll talk about that. We'll talk about that. Is it Muriel? Yes. We'll talk about that for sure. All right. All right. So let's look at our SSRIs. All right. So who are we giving this medication to? Mm-hmm. Yep. Our patient with depression. Yes, yes. So you see why I said to you guys about paying attention to psych alone. We got to know who, which client is taking this medication. Who is this medication for? Okay. All right. So because we are giving it to the patient with depression, what do we need to watch out for? Suicide, ideation. Yep. Self-harm. Yep. So in your questions, you may not see suicidal ideation, but they may give an example. And what's a classic hallmark example of suicide ideation? Self-harm. So what if they're not going around? Yes, yes, that's the answer I was looking at. Increased energy. Okay? Giving away items. Yep. They will start to feel better, right? And then they'll go back. So they'll give you a sign that everything is getting better. It may look like that on the outside, but we know, yes, we know that that's a hallmark sign. So we want to watch out for suicidal ideation. Okay. All right. They will feel better. Yep. They will have the energy to take action. You see how that's also tying into like, well, it is a psych medication, but you can actually, especially for those of you who are taking pharm in psych, or you're taking pharm right now, what I used to do is create a binder, and I would create these concept maps, and I'll just build upon the concepts. So you can create a full concept map and include your medication in it, and you can carry that binder from your second semester all the way until you graduate. It's the same thing, okay? All right. What is that? Increased agitation. Yes, sometimes they will have increased agitation, but for the most, we do want to watch out for them having like the energy. The energy is a hallmark sign. So if you see increased agitation as an answer choice versus the increased energy, choose the increased energy. Okay, because it contradicts what you're giving the medication for sometimes, and you're like, why is this here when I know that I'm giving it to a patient with depression? And the NCLEX is not trying to trick you, but they just want to make sure that you as um, a provider can watch out for those signs. Okay. Yes. So they have highs and lows. So when you make your concept map, make sure you add that. All right. All right. All right, phenytoin, or however we pronounce that. All right, it causes gum changes. What type of gum changes does it cause? Because you may not see gum changes there. You may see, yep, hyperplasia. Mm-hmm. Yep. So it's a specific kind. So you may see gum changes. You may see hyperplasia. And Jan, with the hypertrophy, that's different. That's when the muscle is growing and the size is growing. Okay. All right. So what would we want to monitor for? What would we want to teach this patient? You're so welcome. What would we want to teach our patient? Mm-hmm. Right. Dental hygiene is really important. And the reason why it is important to know these things is because you may see dental hygiene on your exam and you're like, I don't even know why. That's a hallmark side effect for the drug, okay? So even if you don't know all about it, you do know that it can cause hyperplasia. So you may see that and it may throw you off, but don't let it throw you off, okay? All right, what about our heparin? We know to monitor our APTT. Okay. What else about heparin? Monitor for bleeding. Okay, so now that we know we have to monitor our APTT, right? And then we have some patients at home, so we have to teach them how to monitor for bleeding. Okay, how are they going to do that though? Mm-hmm. Right. So who is at risk for this, for easily bleeding? Most risk. Yep. Using electric razors. Yep. NSAIDs, nosebleeds. Heather said maternity. And then we got to think about our elderly patients. You guys see them in a clinical setting. They're usually all bruised up, right? All bruised up. Okay, so we got to monitor for bleeding, all of that. All right, so monitor that. And then we have our warfarin. Okay. Tell me something about warfarin. Also bleeding and bruising. Yep. Usually they to bridge to warfarin, and it's a clot buster. Okay. Yep. And heparin is like a blood thinner. Warfarin, and I believe I learned this from Picmonic when I was a nursing student, but it's used to like destroy, like think of them going to war with those clots. So it's an antiplatelet. Someone said warfarin doesn't get it doesn't. It doesn't get along with a lot of medications. Yeah. And then what about our insulin? Okay. Most important thing with our insulin, you must know your peaks, your peak times. You must know that for the NCLEX. You must know that for your classes. You must know that. That's when we get our index cards and we get to learning, okay? We have to know that. And that's just one of those things that you just have to memorize, okay? Make sure you also know your signs for hyper and hypoglycemia. You are going to be tested likely on hypoglycemia more than you would hyperglycemia. What are some signs and symptoms of hypoglycemia? Lethargy, confusion, increased heart rate, shaking, distance. Yes. Yes. So that's where the peak times comes in. It's really important to know that, okay? And not just for exams, but we're talking about, yes, we're talking about for the clinical setting as well. You're giving a patient insulin, or sometimes they may not have had their, or they could have had insulin overnight, right? The long acting insulin. And then you go and check their blood sugar in the morning and it's 60s, right? So you want to make sure you're monitoring for those signs. All right. All righty. Got an NCLEX question. Clinical judgment is the new flex. All right. Teach you guys strategy how to master pharmacology, and some of it I will say memorization for strategy one, our active recall, but it's not the priority. Safe practices, right? When we're developing questions as instructors, or even when you're being tested on the NCLEX, we want to know if you can be safe, right? Because we're not trying to see if you can pass an exam. We really want to see if you can take care of a patient safely. And hyperglycemia, yes, it can happen as a rebound effect, as an overload of glucose if you're giving glucagon, okay? But typically, it's caused just by other things. It could be stress on the body that could cause that, just different reasons for hyperglycemia. Usually too much. When we are in the hospital, most of the time it's because the patient has eaten too much sweets. Most of the time, they're eating too much food. They're not controlling their glucose at all. All righty. So we got C for a lot of our answers. All right. And the answer is correct. All right. So we want to make sure we're holding the dose. Why are we holding the dose? It's only 1.9. It's only 1.9. Why are we holding the dose? Yes, right. So, yes, the symptoms. And what else? Yeah. So they are toxic. That's the answer I was looking for. Yep. It's out of range. The normal range is 0.6 to 1.2. So even though 1.9 looks low, if we don't know the range, right, the NCLEX will want to know. They will give you the range, but you would have to know that that is abnormal, okay? Because sometimes you may not get the signs and symptoms, okay? You may just get the level, and you will have to know that that is out of range. So they are in lithium toxicity, okay? So we know that this is given for our patient with bipolar disorder, all right? And what are some signs? We see a few signs here. What are some signs? Mm-hmm. Lethargy, tremors. Yep, absolutely. Slurring of the words, right? So we want to make sure we hold that dose and go ahead and notify the provider, right? So this is the NCLEX, this is your instructor, and this is really your clinical preceptor being able to measure if you can recognize cues, right? So you recognize the cues. Can you analyze the cues? What does this mean? I see it, I know what that is, but can I really break down what that actually means, right? You guys were able to prioritize a hypothesis. You were able to see what was the priority question for what is going on here. What would I do? And you took action, all right? So clinical judgment model is going to stalk you all the way until you graduate, and then you won't follow the model as in you're seeing, recognize cues, analyze. You'll just be doing it as a nurse. It'll be a natural thing, okay? So you want to hold that dose. All right, strategy 7, study medications by system. All right, so especially if you, most of the time in your pharmacology classes, you're going to have them by system anyway. But you'll notice that once you get to the very end, when you're taking your finals, or you're getting ready to take a HESI, or you're getting ready to take the NCLEX, then sometimes it's easier to go ahead and study them by system. Most people study their NCLEX by system, or they study most of their final exams by system. So when you're doing that, go ahead and add your medications for it. You know that this is a high yield topic, just go ahead and add your medications. So you're not going back and trying to figure out, okay, what medication do I take for this? Or you have the whole clinical picture of what's going on, but you don't know what medication is needed. So group them by systems. Same thing for OB. OB for our NCLEX test takers, most of you are going to see high yield medications, oxytocin, mag sulfate, Rogam. Why are we giving Rogam? Are we giving it to the baby? Our sweet little baby? No. Someone said no. Right. What is the threshold for Rogam? Right. So we're giving it to mom, but when? When are we going to give Rogam to mom? 28 weeks. Yep. Yep. Awesome. So not only is it important to know what we're given, we need to know why. Okay. And 72 hours after birth, that's a big one. Yep. 72 hours after birth, you'll see that often, and that is a high yield topic. Okay, so usually with your NCLEX medications or your final exams, when we're talking about medications, you'll likely see these medications pop up, but they will be the high yield ones. Like, what are the most, they're all important, but which ones are the most important ones that you cannot escape? These are usually the ones. Same thing with terbutaline. Again, oxytocin, mag sulfate. What are some things? Why are we giving mag sulfate? Are we giving that to the baby? To the mom? Why are we giving it? Yes, to prevent seizures. So if we're preventing seizures, then which patient is at high risk for having a seizure? Yes, mom is, but what type of mom? Yep, preeclampsia. And we can also give it to the mom with eclampsia, right? So the difference between preeclampsia and eclampsia is that now eclampsia, the patient has started having seizures, okay? And for my note takers, you don't even have to be preparing for the NCLEX, but if you're taking OB, whatever you're taking, the main difference between preeclampsia and eclampsia is now the patient is starting to have seizure activity, okay? All right. So we want to make sure we give them the max sulfate. All right, and then we'll talk about the antidote for that later, because there's another medication you want to make sure you have when you're giving the patient max sulfate. All right, what else do we want to monitor for now that we have this patient on magnesium sulfate? Back levels, respirations, magnesium toxicity, yes, respiratory rate, clonus, come on. Yep, high yield things, urine output, yes. Those are big things that we want to monitor for. Yes, DTRs. Absolutely. Okay. All right. Great job, guys. And you will get a recording of this if you want to go back and look over the slide. All right. And this will help you reduce cognitive overload, especially if you are studying by systems, per day. If you, however you're doing it for your finals or for your NCLEX, however you're doing it, or even in class, it'll keep you from having this overload, trying to mix all these medications up, okay? All right. Strategy 8. Somebody's getting ready to take their NCLEX. They don't know the antidotes. All right. I'm not talking about y'all. I said somebody. All right. So these are the top 5 most commonly tested antidotes. See it often. You can't get away from it. So make sure you know your antidotes. All right. We all know naloxone is for opioids. Okay. We see a lot of schools, they're now teaching to carry naloxone. Okay. Vitamin K, we talked about warfarin toxicity. Want to have our vitamin K as the antidote for warfarin. Okay. Heparin, protamine sulfate. If you guys are taking notes, make sure you mark and pay close attention to vitamin K for warfarin and protamine sulfate for heparin. That is commonly missed on exams, including the NCLEX. We mix them up all the time. All right. And then someone mentioned something about monitoring your leafy green intake. Which one are we doing that for? Warfarin. Okay. Awesome. And then why are we monitoring that? Why are we monitoring our vitamin K intake? Make it less effective. Yes. Right. Because it's going to cause it to do the exact opposite. And how we remember that, yeah, it's the antidote. So vitamin K is in that. So it's important to know what type of foods carry high levels of vitamin K. And you'll likely see answer choices that either say avoid it altogether or monitor it. They can have leafy greens. They can have that. They just have to monitor it. So, or sometimes you may see an example where they have a full plate of just different things and it may have a bunch of leafy greens. And that sounds good. You're like, oh yeah, I'm gonna choose this. I'm the best nurse ever. I told my patients to eat a full plate of greens. And that's not the answer, right? You may have just a little greens on the plate for the answer choice, but not a full plate because you want to limit the amount, not completely cut it out, but just limit the amount, okay? Alrighty. Strategy 9. You guys heard me say this earlier. What will kill your patient dead? Prioritize life-threatening side effects. Okay. Um, Someone mentioned in the chat box, and I hate to say someone, but I'll have to scroll up and see your name. So I'm so sorry in advance. But they mentioned how you just get so many side effects, and this is so overwhelming because now you don't know what to test on. All right. NCLEX does not test you on what's common. We know most medications can cause a cough or can cause nausea, can cause headaches, and things like that. They know that, right? They want to see if you can recognize what is critical. Okay, so we talked about our ACE inhibitors and how we just automatically think angioedema. All right, we're thinking, what is going to kill my patient? Airway swelling, right? If you don't know anything, know those high yield side effects that's going to kill your patient, right? We don't see digoxin here again, but we know that toxicity, the signs, you can't get away from that. Opioids, what's going to kill the patient? Respiratory depression. That is what's going to kill them. All right. Look at furosemide, hypokalemia, right? They may not put hypokalemia. Dysrhythmias is what's going to kill your patient dead. Okay. All right. So if they have a side effect of the patient or an adverse effect of the patient having to constantly go to the bathroom throughout the night, that is not going to kill them. The dysrhythmias will kill them. That would be the most important thing. Okay. Insulin, most important thing. You will see hyperglycemia on most of your unit exams. We're talking about the NCLEX, they really focus on hypoglycemia. Not saying that you won't see hyper, but most of the time they focus on signs and symptoms of hypo because it will kill you. Okay. Heparin and warfarin, we talked about that, bleeding, bruising, that will kill you. It can kill you. Okay. All right. So you see how all of these examples can kill your patient dead. All right. Even Tylenol. We overlooked that one. But we got to monitor how much they're taking in per day. And usually when you're giving these medications, they will have a warning if you're getting too close. All right. So you want to pay attention to that. Right. So make sure you pay attention to life-threatening side effects, especially when you are studying a lot of medications in the same class. You want to look at what makes this medication different because you can't escape it in your pharmacology class. Now, for the NCLEX, yeah, you can just pick out, a bunch of high yield topics, things like that. But for your pharmacology class, they're likely going to test you on multiple medications in the same class, and they want to know that you can recognize the difference. And even with that, most of the time they're looking at the MOA. If there's something very significant about the MOA, rarely do they test on it, but you may see one or two. And with that, you can usually tell if your instructor is kind of highlighting it more than they highlight anything else on the exam. They're usually going to point out the MOA of this medication versus the other. But the same thing goes for how I have these medications listed. Like any medication, when you're studying and you have so many, they're all the same and they work the same. I know that they all work for blood pressure, but why would I give this one to this patient and this one to the other one? Okay. All right. So how we talked about our ACE inhibitors, right? And our ARBs, why are we giving one over the other? Okay. It's the same thing. All right. And strategy 10, you want to practice like it's an NCLEX. You want to practice like it is the NCLEX, like you are getting ready for game time, okay? So don't wait until the day of your exam to see exam questions. You want to practice different exam questions because there's only so many ways they can ask you about one medication. And there are different ways they may style the question, but if you know warfarin, then you know it. It doesn't matter if they list foods, they say the word vitamin K, whatever they decide to do, whatever verbiage they decide to pick out, you know it. All right. But you have to expose yourself to different types of questions. All right. This is going to reinforce different clinical judgment patterns, and it's going to show what you actually know versus what you think you know. Because sometimes, you guys know it, we get in that exam and we're like, yep, I studied for pharm. I'm ready for it. I got it. And then the test, the results say otherwise. All right. And sometimes, again, it's not that you don't study, it's just that we don't know how. Right. So, a good way to approach this is to start introducing yourself to pharmacology questions right after your first module. Right. We're talking about, I don't care if it's exam one, exam two, module one. After you study it a bit, by the end of that first week, you should be introducing yourself to test questions on that concept. Okay. That's how we practice smart. So you want to use questions that are styled similar to what you're going to see on your exam. You want to focus on priority, safety. That's with anything. What labs do I need to look at, and what do these labs mean? Because oftentimes we think because the lab values are presented to us, then we're fine. But if you don't know what it means for it to be low, what does it mean for it to be high, then they can give you a number and you're just like, I don't know, right? So you want to make sure you're including those type of questions in your practice questions, okay? Review your rationales. Sometimes your rationales may be the question for, an exam. But if you've already read that rationale, it helps with your studying and your ability to retain the information, and not just retain it, but you're able to think it through. Why was this question wrong versus, oh, this question was wrong, I got it wrong, right? Or sometimes we may get it right and we got it right, but why? Okay. And then, why am I giving my patient this medication versus, okay, here's a beta blocker. All right. Why are you giving the patient the medication? Okay. All right, guys. So we have our two winners from earlier that I'm going to take care of. And then we have our one winner who I hope is on, and that is Miss Jacqueline of Herzing University. Are you on, Jacqueline? I hope so. So we have to be in. Picmonic, give us. Yes, they do. Yes. Aside from what you shared, can we trust? Picmonic give us the most. Yes, Picmonic does give the most significant adverse effects to watch for. Yep. And then pay close attention, Meryl, to things that your instructor may highlight. Okay, pay attention to that. I know the heart sweater is really cute. It's adorable. All right, is Jacqueline on? All righty. Okay, I may have to email her. All right, and then now for our second giveaway. All right, so if you guys can fill out a survey, it's a 1-minute survey. We'll get your honest feedback for the webinar. Let us know how we're doing. Let us know if we need to completely cut it out. You guys would like to see more. How often would you like to see more? And your survey answer is an entry to the giveaway. And one lucky attendee will win a 6-month Picmonic subscription. It is phenomenal. I used it all throughout my nursing program, and I helped other students with it as well. So I'm not just selling a product or anything like that. I'm actually not selling a product at all, but I'm just letting you guys know that I used it when I was a nursing student, and I think highly of it because it really helped me. And I definitely do not recommend studying last minute, but sometimes that's not always feasible in nursing school. And Picmonic had my back. So this is the subscription that you want for sure. And even if you're not the winner of this, you're a winner in my heart. And even if you're not a winner of this, you can still go to their website and sign up if you like. But it's really good. And then if not, someone asks for other resources, there's Quizlet. Quizlet is amazing for creating those active learning questions for pharmacology. And then what I would do when I was in pharmacology is I would go ahead and review. I would just type in pharmacology cardiac exam questions, and I would just get a plethora of questions. So if you don't want to go out and spend money on just a bunch of resources, because that's another thing that I will tell you guys, resource overload is not a good thing. Okay. It's not a good thing. It's very overwhelming. And you're going to be bouncing back to back to back to back for so many new resources that you don't have time to even take in what you already have. So I would say the priority resource would be your instructor's notes, and look at their learning outcomes. Okay. The learning outcomes are keys, because you cannot go out of this parameter for what you're going to test me on. This is the outcome. Just like I put in my outcomes, what I was going to give you, I delivered that. I cannot really go outside of those parameters. I cannot underperform those parameters that I've already set for myself to give you. So the instructor would be key, your notes. Then from there, you find one resource, no more than two, that can help you. Okay. But if you don't have an NCLEX book, or you don't have a question bank, then I definitely recommend maybe Quizlet and just typing in pharmacology, cardiac exam questions, and you'll have just a bunch of different questions, right? Because it's about building that momentum to test. Most of the time, it's not that we don't study, we just don't know how to study. And you can have all the information in the world, and most of my clients are just not the best test takers initially. So that's another component. But when you introduce yourself to a bunch of questions, then you can kind of help yourself in that area with being exposed to different questions, okay? You are not a terrible test taker. No, you're not. Most people say that. You're not terrible. We won't say that. But sometimes we may need a little bit more help in learning to take the exam. And that is a different component, okay? It's a different component. All right, guys. If you guys filled out the survey, I will go ahead and put the results in, and I will have the winner actually tonight, but we will announce it tomorrow morning, okay? All right. All right, guys. And then last but not least, if you enjoyed this and you would like to see more, you need private tutoring, just anything like that. I do travel to different campuses, and I help with NCLEX programs and NCLEX readiness, leadership, content focus, whatever it is. This is what I do on the regular. This is my email. If you guys need any additional help outside of this and you just have a question, um, feel free to email me. Jay, I am struggling in this. Can you just answer this question? And I'm always available. I'm more than an instructor. I'm a mentor. I'm a mentor first, okay? So yes, feel free to reach out. It's not that you are bad test takers, but it's a strategy to taking exams. And a lot of it is just introducing yourself to the same thing over and again, and different styles of answering the question, because sometimes we can be so used to seeing it a certain way, and you mix the question because you're like, I'm not used to seeing it that way, you know, and that's not a good rationale for missing a question. So you want to expose yourself to different types of questions. Yes. So we will actually send the link out to you guys so that you will have access to the recording. I believe it's going to be on YouTube. The last one was, so just stay on the lookout for that. But we'll make sure you guys get everything you need, okay? All right, guys. Well, that concludes our session. I hope you guys enjoyed it and you were able to take something with you to help you with pharmacology. You're so welcome. You're welcome. You're welcome. You're very welcome. There you guys. If you have any questions, you're more than happy. I mean, more than welcome. I'm more than happy to stay on. But if you guys have any questions, I'm here. All right, my friends, I am signing on.